So hello, everybody. Welcome to our nursing town hall. As I round and see the great care that's being given, I often hear so many compliments from the nurses about all the support they've been getting throughout the organization. Yesterday, we had 6 COVID discharges leave us. And this morning, we just extubated a patient in one of our COVID ICUs. We're doing a lot right. And we all know as nurses that that takes a tremendously dedicated care team. And here at Tufts, we consider everybody who wears a badge a member of the care team. And we thought it would be a really great idea to bring some folks that work more behind the scenes, some more than others, and really share what their role has been in really standing up and supporting people who cross the threshold and care for patients and making sure that we have what we need to do that. And it's been a real incredibly inspiring time to see everybody band together and be so passionate about meeting the needs of this really unique patient population. So Diana Richardson is joining us today as our COO. Welcome back, Diana. We know you love these. You keep coming back. Thank you.
I do love these. And actually, I genuinely love these because one of the things that we have found in this very challenging time is that decisions have to get made very quickly and information changes quickly, which means processes and the way we do things and who does what and what we do it with are changing on a moment-to-moment basis. And the beauty of these town halls is being able to hear how teams at the local level are figuring out how to work together with, okay, it was this way yesterday and it's this way today, and actually making that work to safely care for the patients and to make sure that we're also protecting the healthcare workers. So this is really, I'm going to steal one of Terry's favorite words. This is really a joyful experience every time we have one of these, at least for me, and I always learn something. I could tell you one of the things that's been great as we have rounded through different departments is to hear that creativity and many ideas that have started on the local level, we've now spread across the rest of the organization. So I can't wait to hear today's stories and sharings, and I know I'll learn a lot. So as always, thank you all for what you're doing. This is not easy, and I have never seen a more amazing team tackle the challenge. So looking forward to it.
Thanks, Diana, and thank you again for all your support. Lots of rapid decisions, and it really helps to have a team that really always considers what the patient needs and those closest to the patients. So our panel today, we have Deborah Martinez, who is the director over our central processing department. We have Ryan Flaherty, who is our director over supply chain. Leslie Lucier, our director over respiratory therapy. Michael Kennedy, our vice president for hospitality. Thank you for spending your time with us today. Really appreciate that. Why don't we start with Deborah Martinez. We know that your team's been working super hard in central processing and doing things very differently than you did just a few weeks ago. So you got the floor. Oh, hey, Deb, take you off mute. You're on mute.
Okay, much better. So as we all know, the surgical volume has gone down. So our norm of putting together surgical sets for surgery has diminished. So what we've been able to do is we have processed thousands and thousands of eye shields, this type, and we collect them every day. We go around, we collect those, we clean them, we actually sterilize them, and we bring them back up to the floor so everybody can have their PPE. We also have started reprocessing N95 masks, which we have on hold. We will not redistribute unless we need to, but they're already been reprocessed, and that's part of what's in my office here. My team has been awesome as far as willingness to want to get work done and help out the hospital. So we go to all the floors, and we've collected from everywhere now. And one of the other things we have done is we've worked with Leslie and her team, and we're also, if things get worse or more than the respiratory therapy team can handle, my staff has been trained to help out her team 24/7 by either acting as runners to bring equipment to any of the floors, bring equipment back down to respiratory therapy. They'll help clean the respirators, and we'll do that until, as long as we're needed. But so we're keeping pretty busy up here. Everybody's spirits are high, and we've just shifted our work a little bit, but it's been good.
Well, I learned something new too. I didn't know that you were playing backup for respiratory therapy in that way. That's really great. I think having your team just be stand ready to do whatever, close a gap, whatever gap has to be closed has really been fantastic. And nurses on North 7, for example, who never interacted as much with your department are singing your praises. Julie Sherman, are you on the line? Would you like to make some comments? Take yourself off mute. There you go.
Can you hear me?
Yeah, you're good.
Okay, hi. Yep, thank you. Yes, partnering with CPD, usually the medical floors don't have any interaction with them, and we have been able to develop relationships which have been very supportive and cohesive and much appreciated. And the reusing of the goggles right now has been a lifesaver because they are going through quite a bit. So we appreciate that very much.
Right, we're happy to help. I'll pass on that word.
Thank you, Deb, and thanks for the great teamwork. Julie, your team has also been really receptive to trying on different things. And like Diana said, like all of a sudden today, we're starting to reprocess and sterilize goggles, and people were just going with it and really receptive to the need of figuring this out one step at a time and working together and not getting overwhelmed by the rate of change, rather really leaning into it, accepting it. Welcome, Mike. Thanks for joining us this afternoon. We've got a panel right in front of us. Would you like to say a few words?
All I really want to say is thank you. It's been really inspiring to see the level of teamwork and collaboration across the organization. One of the things that I think is going to be one of the probably many silver linings that we're going to find coming through this is just how much we're all learning about each other's roles and how much we are developing a much better understanding about what does it take to run a hospital, to expand our capacity, to take on new challenges. And it's just really been awesome as I've rounded with you, Terry, or with other leaders or myself through the different units, just seeing how many people are taking on new roles, learning new skills, preparing for to embrace new challenges in ways that I don't think we've ever been called on to do before. I think we've always had the skill, and we've always had the ability and the kind of focus on patients and the focus on the organization that it takes. But this is really, in many ways, kind of revealing. I keep saying it's revealing our superpowers. It's really helping us see what makes it a great organization, and you really see it everywhere you look. And whether it's in environmental services, in pharmacy, in CPD, in respiratory therapy, in nursing, in medicine, and the level of cohesiveness and collaboration is really something that people should be very proud of.
Thank you, Mike. I totally agree. It's whenever we round, I try to count how many ideas people bring forward, and it's just endless. Even from where we could maybe provide different ways that people can eat in spaces where we've cleared out the table. People had creative ideas as to what we can do there. It's just relentless and ongoing, bunch of smart people trying to do this work together. Thank you for being with us today. Okay, next we got Ryan Flaherty. Ryan, as I said, the Director of Supply Chain. I've gotten a fair amount of emails from a lot of us, and he's here. I think he lives here. So Ryan, the floor is yours.
I don't usually turn the video on my calls, and I'm realizing just these deep bags that are under my eyes. So, a couple people have pointed them out via text message so far in the last few minutes, so thank you to those folks. So the work in supply chain has been feverish, I would say, over the course of the last really 2 months. We began really shifting the way we do business, where we traditionally had relied low unit of measure program here at Tufts. We have kind of switched our philosophy on the fly and are trying to source really every supply that we deal with here in a bulk capacity. So the supply chain as a whole has, if you pay attention to the news, has taken a large hit, and that is indicative of everything we're seeing here. But the team has banded together and is doing, I think, amazing work. So we've got support from every level of the organization. The people that I'm seeing on the call here, Leslie and I are in constant communication with each other about disposable supplies that she may need, trying to get loaner and rental ventilators in. Deb, the work that CPD has done to reprocess the goggles has given us some breathing room on trying to source goggles and allow our focus to remain elsewhere. We've also been trying to support the standing up of new ICUs and moving units from here to there. And my team has, built out numerous different supply carts and just trying to kind of stay flexible and remain kind of ready is of paramount importance. So some of the cool things we've been doing. One of the things I think is important for everyone on the call to know is the amount of donations that we've been getting is very large. They continue to pour in. They've been pouring in for about 3 weeks at this stage of the game. We are inventorying them. We have them palletized right now. I think we have 8 pallets of supplies that have been donated by various folks, some large donations, some small, all being tracked in case we ever get to the point where we do need to use them. So that's just a little bit of it's a 24/7 operation right now, just trying to source things, trying to weed through all of the various sales leads that are being thrown our way. I would say there's nothing short of 2,000 different leads that we've had to try to chase down, verify the validity of these items, and then go chase it for purchase. One thing that's been tremendously helpful to us is that the administration at the Tufts level and at the Wellforce level has been tremendously supportive. There have been no requests that we've gone to them with, and they've said no from a financial perspective, right? So we are out there, we are sourcing, and we are spending a significant amount of money on those items. So that's pretty much it from my perspective. It's constant, and but the work that is going on is very cool, and the teamwork has been tremendous. I think without the teamwork, we would be in a very different position.
Well, I can't thank you enough for really working tirelessly to secure and source PPE for the teams. We do hear when we round that people feel like they have that equipment that they need to care for patients. And sometimes we get the credit for that, but you're the person who's actually figuring it all out behind the scenes, negotiating and making sense of it and making sure that it gets in the hands of the people who need it the most. I don't know if that's a real word, palletized, but I learned that one new word, palletized.
It's a word now.
There's so much about supply chain I don't know, but really, really seriously, we thank you, because it just really matters that our teams feel secure and confident when they cross the threshold. And we know from the town hall yesterday, Diana shared that PPE is going to look different because it is shifting, right? We're getting different products in. So we're going to have to adjust some of the things we do, such as the face masks, but we know we can figure that out. So thank you very much for your partnership. Janice McLaughlin, I know, has been working closely with you, and when I feel like I can't bug you anymore, she does, and you've really been a true partner. So I thank you very much for your work.
Janice might be on the line, Terry. She's on the phone, so I don't know if she can unmute herself. I'm not sure which number she is.
Janice, are you there? Okay. Well, anyway, thank you for everything you've done, Ryan, and your teams, and the people on the loading dock, and all the people who are making this happen for our patients and our care team members. Thank you. Next, we've got Michael Kennedy, our Vice President for Hospitality. Thank you, Michael. You've got the floor. Welcome.
Thank you so much, and thank you for having us, and thank you for all you and your teams are doing. I can echo Ryan's sentiment around the support and just the overwhelming response from both Tufts leadership and WellForce leadership in terms of making sure we have the resources we need and the people and whatnot in order to get the jobs done. So thank you so much for that. So I represent hospitality services, which includes EVS, patient transport, patient equipment and linen services, facilities, food, patient services, food, and then retail. And I have a team of people that support me. Lauren Sampson, who's our new EVS director, who picked a bad week to get into housekeeping and healthcare. She started about 2 weeks ago. Kevin Kosholik, who is directly responsible for the patient transport, patient equipment, linen, and the hospitality call center. Jeff Shalute, who's our facilities director, and then Kevin Moore, who oversees patient services, food, and retail. And I think from a standpoint of a team, what's been good, because a lot of us are very new, we've been put into a position to have to rely on each other and work together and really get out and work with our other support service brethren as we've tried to work through the processes here. Some of the highlights of the things that I think are relevant to what's going on is really has been a lot of managing of supplies on our end, making sure that the panic of the no toilet paper out there in the paper doesn't happen to us. We've been able to make sure that we have enough toilet paper, and if any of you guys know Vinny, you'll know Vinny is running out of places to hide toilet paper. So we have plenty of toilet paper. It's not going to be an issue. We've developed a lot of pandemic supply chains, so linen, chemicals, Pure One, so that we have the ability to clean and sanitize spaces. All those things have been managed up front. I think really, to Mike Apcon's credit, we were way out in front of this. I think he saw this ahead of ahead of a lot of people, and we were getting way out in front of this in terms of securing supplies and making sure that we'd be in a good position as we work through this. Additionally, we had to look at our workflows too. We've looked at new pathways for cleaning, for transporting patients, for delivering food, and there's been a lot of work that's gone into that process, and it's really been multidisciplinary, working with Amy Lund and working with Lisa Capra and other folks within the organization to make sure that our folks are safe. And I was sharing with Diana this morning, so happy to report, I guess happy as could be, that out of 300 support service workers, I think we have 5 that were positive for COVID at this point. So really the work that the organization has done in making sure our folks are safe has really paid off, in thinking that our teams are able to support you and the work you're doing and being safe at the same time. Some other things, as we've reallocated staff, we've put patient transporters with purple tops and wipes so that they're wiping down elevators and maintaining otherwise spaces that's really hard to be omnipresent in, and so making sure that those areas maintain are clean and safe, and that we're able to support their housekeeping brethren in that process. From a facilities perspective, it has really been, as we've gotten heads up that these units would be converting, we've been able to get in and do a lot of overhaul, making sure that lights are changed, that the space is going to be really efficient to work in. Housekeeping's been able to follow behind and make sure that the places have been detail cleaned, stripped, and refinished. There's just been a lot of that type of work going on, as well as we've seen a decrease in census. We've been able to really accomplish a lot of project work that had fallen behind throughout over a period of time. So a lot of that going on. Also, on the other side, on the good news side, is we're managing the food donations. So as food's being delivered to the units, it's coming through our department and delivered through us, and also we're supporting and providing the daily hospitality cart with partnership with nursing and bringing around drinks and snacks for people as they're on the floors, to really try to brighten people's days up as they have been long, and anything we can do to make that better. So I think unless there's anything else, that's it for me.
Thank you, Michael. Thank you for the dedication of your team and yourself. It's definitely been a challenging time for the organization, and to see your team really right there on the units and, really helping us to keep the organization clean has really been remarkable. I love the shiny floors on the 3rd floor and the rooms that you've been able to get into. We got to take full advantage of any ability to get in there and clean, and your teams are all over it. So thank you very much. We really appreciate everything that you're doing and your team is doing. So that's really great. Next on our list, we've got Leslie Lucier from Respiratory Therapy. Leslie is a director of respiratory and ECMO therapies. And on the news and everywhere, it's the amount of ventilators and therapists are so important to the treatment of this disease process. And Leslie has been in the fold of many, many, many important conversations. Welcome, Leslie.
Thanks so much for inviting me today to the Nursing Town Hall. So I'll give you kind of, our approach to this was really, as we worked on our surge plan within the hospital, we took it in kind of 3 different arms. So in one arm, Ryan touched on that. That's really our supply preparation, building pandemic supply, identifying what we would need. One arm is very vent focused for equipment. So in that arm, we identified what are the pieces of equipment throughout the entire hospital that we could use for adult ICU ventilators. And now we keep a very close eye on that. We've been working with rental companies and with Ryan's team really closely to continually sequester and seek out new vents every single day. And then we also have been working really closely with anesthesia and plans to potentially, if we had to, use an anesthesia vent for ventilation as well. And then finally, kind of the arm of, expanding our geography and providing additional support for ICU patients as we surge into other areas. That's really then transitioned into a staffing allocation plan. And so for that, kind of the obvious ones within our department was to, pull from our clinical leaders and our department educator. We then, I'm also the director of the pulmonary function lab. So we pulled those 2 employees as well and began to train them in low to moderate level respiratory care support. A little bit of background, like they're both exercise physiologists. They're involved in, we identified their skill set that they perform cardiopulmonary exercise testing. They're used to monitoring hemodynamics and assessing work of breathing. So that was a very easy transition to be able to train them to some low-level respiratory care devices. We're exploring options for respiratory therapy students. I think that's something in nursing you were able to do as well for nursing students. As Deb mentioned, it was very, I have to highlight the OR between CPD and the perfusion team have been 2 of the most supportive teams as far as like enlisting their support and being ready to jump right in. So our colleagues in perfusion are ready and able to assist us for ECMO coverage if and when that time comes. And then Deb's team, we met last week and we talked about just the things that Deb mentioned. So it's helping to run equipment. If we're really getting backlogged with processing equipment, giving her team a call. And I have to say they were extremely helpful and very enthusiastic in what they could do. So thank you for that. In addition to our staffing plan, we also have kind of been working with different ICU physician teams. And that goes into a model where we really anticipate we have kind of trigger points that we've aligned. And so, for trigger 1 is really an assessment for our ability to support pediatric transport. In preparation for that, we began to train the NICU fellows and the pediatric transport nurses on the ventilator and the non-invasive equipment on the external isolate. That began last week and that will continue into this week. We met with anesthesia and we did our first training session this morning with 2 anesthesiologists on the ICU ventilator management, modes of ventilation that are used, introduction to our equipment, and that will continue daily as well. We then, so really working with these teams, we really tried to develop, and my communication to these teams is, you'll hear from me when we transition from each trigger point to need, additional support. And so that's been it's been really nice to kind of work with everybody more in depth, and we really have a lot of kind of consideration and a really comprehensive plan as we move into this. But I also just want to thank, many of the RTs have noted that their collaboration and being included in simulations and different processes with the nurses has been really well received, and they really appreciate it. I think it's been nice to kind of even work together much more closely, especially in the COVID units where the team entering the room is really a dedicated, smaller team. And I think many of them have said, like, it's been really nice to work, so closely with everybody. So thank you for that.
Leslie, that's great. That's a real lot. You've got a lot on your plate. Your team's been doing an outstanding job. And you're absolutely right. It does take a care team in those units, and like every unit, in order to take great care of really complex cases. So as we look to thank all of the departments who are here today and really working as one, as a care team, caring and standing up what it takes to care for these complex cases, and really truly a spirit of learning and innovation every single day, and a little bit of research and a little bit of trial and error, and giving each other space in order to explore. Love the overlap and the interdependence that's occurring across the organization. I agree with Mike. I think it's a brand new day for that. I think we're going to find super skills and superpowers in ways that we didn't even know existed. And also the rate of change that we've been able to endure has been quite remarkable. I get a lot of questions about our surge plans. I'd love just to spend a couple minutes on that. So it's amazing because just a couple short weeks ago, we decided to open up COVID units, what we called COVID units, so that we could really perfect the skill, the training, and also the PPE sites. And now we've expanded to 8 inpatient units and our emergency department. So it's quite remarkable. And what we base our decision on is really the trends in the country, the trends in Massachusetts, and the trends within the academic medical centers in Boston, as well as our partners at Wellforce. And so over the past week, all those have gone up considerably. And so we've needed to take new steps on our surge plan to introduce different units to being a COVID or a hybrid COVID unit. We do use a visual to help us keep track of what that is. I'm just going to show it to you. Several of you have seen it, but it's just important that you can see that we, as an interdisciplinary team working together with Saul Weingart, Eric Garpestat, different members of pharmacy, Ross Thompson, and the whole world, we think through where we should go next. So right now, here are the critical care units here, and the orange indicates COVID. The hashtag here indicates hybrid, meaning some COVID and some non. Yesterday, we just stood up the MICU to be able to care for PUIs and COVID confirms. And the neuroscience unit combined with the IMC makes our COVID ICU, which is our first ICU. Picky has done a phenomenal job. Our pediatric ICU is taking adult patients as well as pediatrics, adults up to the age of 30, and that's been remarkably helpful to the whole entire care team. How we manage these beds is now being done a bit differently too, as a result of learning that process communication and really triaging can really help care for patients better by deciding who's getting the next admission, who is more prepared. So that's being done with physicians and nurse leaders 24/7. So a thank you to Eric Garpestat and Saul Weingart for that support. We are looking and exploring some other places as well for critical care expert, and those are down here. And we're continuing to have the conversations about where's the next place that we need to step into to make sure that we've got the beds, the equipments, the ventilators, the nursing staff, the monitors, etc., and all the supplies that we need. Here's our med-surg layout here. North 4, we stood them up last week for COVID, and they actually have more patients today than North 7 does. Congratulations to all these units who have really embraced this. And then we continue to look at other places as well, as far as who should be standing up in order to take care of COVID patients. And a real shout out to the emergency department. Every single day, nearly every single hour, they're admitting patients who are PUI suspects or COVID suspects and really doing a tremendously great job. And in the last 24 hours, talking about being responsive, we have introduced in some of our specialty areas a PUI patient and a COVID confirmed. And those patients, those staff, and I think you know who you are, have been preparing to do this. Stand ready, even though the frequency rate and the predictable rate is quite low. they had been practicing and being prepared to manage patients, and they were ready when those patients arise. So it's really a testimony to how we work as a team, how we think ahead every single day. Our motto in the command center is we look back and we see what did we do, what happened, and then we look forward and we try to be prepared, not only for the next 12 hours, 72, but even well into the future, to make sure that we're always, if possible, when possible, a couple of steps ahead. The colleagueship on the part of the nursing staff has been phenomenal. Another thank you to every single nurse who's either gone into a place and left their comfort zone, and or embraced a nurse who left their comfort zone and then and helped to mentor them and really help them be a part of the care team and feel the level of respect and purpose that is really needed in order to deliver this great care. We have seen a lot of innovation together by bringing people from different areas together in one unit. People see things differently with new eyes. So sometimes they're mentioning either the layout or the flow of work and wondering and suggesting something that lands really positively with the core team. So there's layers of positive learning here. So thank you for all of that. I would say that our preparations are going to not stop until we feel that we have really surpassed and are well beyond this pandemic. So we're going to continue to look at training, education, teamwork, continue to look at the best way to prepare all of you to care for patients. Also challenge each other about scheduling. We need 24/7 staffing here in order to meet the patient's needs. There have been nurses who aren't used to working nights who have volunteered to work permanent nights for a period of 1 or 2 or 3 months. I applaud you. I thank you for that. The night nurses and the patients here at night need care as well. And if you're interested in doing that, we would love to sit down and think through how we could make that work for you and the patients in need. It's extremely important that we continue to do what we have been doing, and that is dig deep and find out what each of us can contribute during this time of pandemic. It's really working for the organization. It's working for patients. Mike, before you got on, we shared that we extubated a patient today with COVID in the ICU. We discharged 6 patients yesterday. We love to save lives here. That's what we do. We're hooked on that. We love to improve health. That's why we're so committed and show up to work and all work together as a team and get tired. And yes, Ryan, have bags under our eyes. It's all because it's really important. And today we might be caring for patients we don't really know yet. And tomorrow we're caring for some of our families, right? Some of our own family members and members of our care team have been here. So it's really, this is for all of us to build healthcare to be strong right now. Diana said it and Mike said it. I am incredibly proud. Our leadership team is incredibly proud of everybody and everything we're doing. We're seeing the best sides of ourselves right now. And it's not over yet, but continue to bring ideas forward. People are brilliant, and we love the ideas that we're hearing, and we're making the most out of each one we hear. Yesterday, a nurse emailed me, and he said, I think the bear should have a mask on because that's what we're doing, and the bear should be safe and a symbol to the community of what safe practice is. I tell you, I don't know who put that mask on that bear. It wasn't 2 hours, and that bear was masked. And so, like, I have to think that that's either facilities or some other department that stood up and said, like, we can do that and make that happen. So we're all in this together, and we're gonna do this right, and we're gonna get ahead of this. And years and years and years from now, when we're all really old and wrinkly, we're gonna be telling our great-grandchildren about how great this organization was. And in closing, I'd love for Mike or Diana, maybe Mike, you go first. Any thoughts you want to end with? You're still on mute.
Sorry, I was trying to get myself unmuted here. I'll just end the way I started. Thank you. I mean, it's really inspiring hearing everything that's going on, how fast we're moving. We have been using all the time that we've had to get ready incredibly well. And the one thing I'm absolutely confident in is that we are doing everything we can to protect our caregivers. And as Ryan shared, we're doing everything we can to bring in the right materials to give people what they need. And we're doing everything we can to be as prepared as possible to care for the people that need us, whether they're people that rely on Tufts Medical Center or they're our own families, and we'll be there.
Thank you, Mike. Diana.
So I'll just add I think what was really highlighted by the experiences that were shared today is probably a little bit more than it takes a village. I think it takes much bigger than a village. That would be a medical center, I guess. And it's really just phenomenal how no matter what your role is, you are part of the care team. And I think that was really highlighted today. So the teamwork, the spirit, the creativity, the problem solving, the esprit de corps, just, please keep it up, keep taking care of each other. As Terry said, we are so proud of you. And thank you for all the sacrifices that you're making right now, whether it's sleep, having to juggle things with family and transportation. We know it's hard, but we appreciate you, and our patients really appreciate you. So thank you.
Thank you, everybody. Have a great day. We've got this. Thank you.